I'm Mackenzie O'Keefe in the CBSN Denver studio, and coronavirus has really turned the world upside down. From online learning to working from home, things have changed a lot. And one thing we've probably all noticed is we're looking at computers a whole lot more. So joining me now is Dr. Nicole Wellensiek from Visionaire in Littleton. So how has this increased screen time really affecting our eyes?
Well, I'm seeing a large increase in people just complaining of eye strain and eye fatigue, especially as the day goes on at the end of their school day or work day, and also just an increase in people complaining about dry eye symptoms.
Yeah, this probably isn't something a lot of people expected. So what should we be doing to better take care of our vision right now?
Well, I'm writing a lot of prescriptions for computer glasses just to really take the workload off of the visual system. And people are noticing a big improvement in how their eyes feel at the end of the day, but also small things that we can do on our own. We call it the 20-20-20 rule, meaning, about every 20 minutes, take about a 20-second break and focus on something about 20 feet away, so something in the distance. Remembering to blink more often. I know that sounds kind of silly, but we actually blink about 50% less when we're looking at any sort of screen or device. And of course, if we're not blinking, the eyes dry out much faster. And using some artificial teardrops, that can sometimes be confusing. So we direct people to, which ones are best for them and what they should be using.
Interesting. We know those blue light filter glasses have become a lot more popular lately. What do those filters do, and do they make a difference?
That's a great question. It's really just reducing the amount of blue light that gets into your eye, basically. It's a little bit controversial because you'll hear studies that show, either way, yes, we should use them. No, they aren't making a lot of difference. I think what we're finding is that not as much blue light gets into the eye from computer screens. It's a very small amount. So yes, blue light can damage parts of the eye, but it takes quite a bit more blue light to actually do that than probably what we're getting from screens. Anecdotally, I definitely have patients that feel like it's helped them, but I'm not sure the science completely backs that as of now.
That's very interesting information. So we know too, coronavirus is not only affecting our eyes, but how can COVID be transmitted through our eyes? What do people need to know about that?
So there have been some small studies that have shown the ACE2 receptor protein, which is what the coronavirus binds to. That receptor protein has been found in the eye, which would lead us to believe that, yes, that is a pathway that the virus can infect us. But it was a very small study. I do think we need just larger, more comprehensive studies before we have a definitive answer on that. But that initial information is kind of pointing that it's possible.
We know some people too are staring at the computer for such long periods of time. Is there a certain amount of time they should be looking at it and taking a break, or anything that they need to be aware of with that?
Sure. I mean, really anything over 2 hours is going to have an effect on just how our eyes feel and the dryness piece. So I know it's hard for students and people working from home to be able to do 2 hours or less. That's probably not possible, but really just trying to take those breaks. Even if it, like, as I mentioned before, if it's just for 20 seconds, every 20 minutes or half an hour, that helps tremendously.
Great. Is there anything we haven't touched on that you think people should know about with this?
On the dry eye piece, I specialize in dry eye, and I think one thing I would like to mention that a lot of people aren't aware of, dry eye is difficult in that it's multifactorial. So there's so many pieces to the puzzle, computer use and our dry climate. But a big component that we know about as a profession, but the general public probably doesn't know about, is the involvement of our meibomian glands. Those glands are found in our upper and lower lids, and they produce oil that makes up part of the tear film. And a study was done that showed 86% of dry eye has a meibomian gland dysfunction component. So that just means that's a huge percentage. And so in those folks, the meibomian glands aren't functioning properly, which in turn means their tear film lacks oil. which means our tears evaporate much faster and then the eye dries out much faster. So 86% of those dry eye cases do have meibomian gland dysfunction. We shorten that to MGD. Here in our office, we are routinely imaging people's meibomian glands, as well as determining the function so that we can also address that in the treatment. If we're not looking at that, we are really ignoring a big component of dry eye.
Oh, that's very interesting and good thing for some people to know. Thank you so much, Dr. Wellensiek, for that information.